have your Facebook switched on your laptop? If you do, can you switch it off?
Yeah, it's not on.
It's not, huh? Okay, because it might interfere a little bit. And we are on. It's just going to take a little bit of time to not lag.
Yep, you're doing fine. I can hear you clearly.
Oh, cool. Good. Let's okay, great. I think we're good to go. And we're just hitting 6 o'clock. So good evening, everyone. My name is Hital Doshi, and together with me is Dr. Hijaz Rizwan. We're super, super grateful to have him here. Dr. Hijaz is going to be talking a little bit about his insights as a doctor, providing psychological first aid to the medical professionals during COVID-19. He's a trainee psychiatrist working in Hospital Tengku Ampuan Afzan. He has taken a nice, decent amount of time to be here with us today. He's also got a personal story to share potentially. He's just himself gone through a medical crisis of sorts just a couple of months ago, was it, Dr. Ijaz?
Yeah, about a month.
About a month
exactly
ago.
a month.
About a month ago. So Dr. Hijaz had a bit of a heart attack scare, got hospitalized, and in the past few weeks is still going around doing his level best, supporting all the healthcare professionals that are going through probably the highest level of stress and anxiety that they've ever gone through in their lives. So together with me is Dr. Hijaz. Dr. Hijaz, thank you so much for being here.
No problem. Nice to see everyone. I'm looking forward to share whatever I have with all of you.
Yeah, great. So, Dr. Hijaz, so you're a trainee psychiatrist, and your job is to support the well-being or the mental well-being of your doctors and nurses and administrators as well in the hospital. Is that correct?
When you're in the psychiatric department, okay, your 9 to 5 job goes on as usual. Okay.
Sorry, could you speak up a little bit louder?
In the psychiatric department, okay, your 9 to 5 job still goes on as usual.
Yeah.
Or 8 to 5. Okay.
Yeah.
We see patients in clinic. We still manage patients who are really unwell in the wards. We take referrals from all over the hospitals. Okay. But since the pandemic of COVID-19, we were given a specific task to handle staff members, i.e. the frontliners who are busy screening and treating and managing all the patients who either have the virus or are suspected having the virus.
Yeah.
So what we do is that we give a phone call initially, okay, and just ask how they are, how they're coping, and from the hundreds, approaching thousands of phone calls that we've made, a lot of these heartbreak and challenges that these people are facing day in and day out.
And Dr. Hijaz, you were actually saying that the way that you make a decision about who you're going to call and the priorities of who you're going to call was based on doing an initial survey, which is called the DASS, which is the Depression, Anxiety, Stress Scale. Was that correct?
That's correct. From the initial part of our survey, we disseminated a very simple survey, okay, which would divide your compartmentalize into stress, depression, and anxiety. Okay, and based on the scores, some people would have high levels of anxiety and depression, low levels of stress. It can vary, and some people can have all. Okay. And based on that, we will prioritize according to the severity and call each one of them. However,
Right.
nowadays, I think we decided that number one, the frontliners actually do not have time to do the survey. So we're actually calling every one of them. Just yeah.
Oh,
So there's no,
yeah.
there's no. So we are efficient. We weren't, but we are now efficient enough to blanket everyone in the hospital. So that's a
Right.
good progress.
Yeah. Two questions, just in line of what you're talking about with regards to assessment. You speak about the depression, anxiety, and stress scale. What is the difference between depression, anxiety, and stress?
Okay. Number one, depression has a lot of depression revolves around your mood. Okay, how
Mm-hmm.
you feel each day, whether you're motivated enough to get up, to eat, can you sleep at night? Okay, and when we talk about anxiety, there is some overlap. Okay,
Mm-hmm.
but anxiety revolves around your thinking. Okay,
Mm-hmm.
what will happen? What's the worst case scenario that can happen? Will I get infected today? Will I infect my family members? So it is kind of a repetitive kind of thought cycle. Okay,
Mm-hmm.
that can be either specific, okay, or generalized, means that he can worry about one thing or many things. Okay,
Right.
and when you talk about stress, it's just based on pure workload, the stress at work, and nothing, you know,
Mm.
stress at.
So the demands, the external demands that are placed on top of you, I guess.
Yeah.
Yeah.
Most of the time it overlaps.
Mm-hmm.
Okay, but the questions are really tailored. It is an evidence based survey. It is tailored to really differentiate between the three, and it's
Right.
quite accurate. Yeah.
Right. Love to continue talking a little bit about that. But what I'm so impressed by is that a lot of times companies or organizations distribute surveys. For example, it could be the desk or it could be anything else like employee experience surveys or employee engagement surveys. And you're absolutely correct. A lot of them may not have time or they cannot be bothered to complete these surveys. I think what's incredible that you've done is that you've actually picked up the phone and called them. How many people did you call? How many, employees in the hospital did you?
Um, well, I can give you numbers for, well, yesterday was about 60, today was 90, so it's increasing every day. Those are the numbers that we get every day, and it's not me. It is a team effort.
Right.
We used to have maybe 2 or 3 members per team,
Mm-hmm.
okay, that does calls every day, but we see now that whoever is free just comes into the department and joins in. So the
Mm-hmm.
numbers are increasing because we're seeing the benefits actually, and besides helping them, okay, it actually helps us as well. When we offer our services, and it feels like we're making a difference, no matter how small. Yeah.
I'm sure you are. I'm absolutely sure that you are. From the little time that I've had chats with you, I've already felt like super comfortable in your presence, and just because there's really nice, calm energy around you as well. To think that you had a heart attack just a month over a month ago. We'll talk about that later. Definitely, we'll talk about that later, and the importance of healthcare professionals looking after themselves as well, or having someone look after them. With regards to the hundreds, close to thousands that you have either surveyed, interviewed over the phone, what is the common experience that you're hearing across the board? What is the biggest anxiety, stress, or depression that they're going through?
In times of crisis, we tend to look for support. Okay, when we are stressed, okay, we need someone to listen to us, to talk to us. Okay, and probably the most stressful thing about these workers is that they're alone. Okay, they cannot go back to their families because of fear of infecting them. Okay,
Mm.
I've had a doctor who live with other healthcare professionals, doctors and nurses, but they've made it a rule that even though they are housemates, they stay in their own room and only come out if necessary because they fear that
Mm.
they might infect each other. So
Right.
I think the main stress will be the isolation. Okay, the isolation. Of course, we can give alternatives. Why don't you video call? We have Skype, we have WhatsApp call, we have FaceTime, but that is nothing compared to human, face-to-face communication, the eye contact, the physical side of communication that has been lacking in them. So I think that affects a lot.
What is it about face-to-face human connection that is completely different from this digital interference that can be between two people? What is that difference? What is
Now,
it doing energetically or physiologically or?
You with digital interference, I'll expand on that. Again, technology. Yeah, exactly. Technology is not perfect. Okay, it's not perfect. Technology can never.
No, we have been scheduling this a couple of times.
Exactly. Even I think number one, humans are social creatures. Okay, that's something that we cannot deny. Okay, and socializing is not a one-dimensional thing. So when I talk to you or when you talk to your family via video conference call, it's rather one-dimensional. Okay, it's much better than maybe 10 years ago where we would write letters or maybe a phone call. Okay, now it's much better. But we've grown accustomed to that physical bonding side. Okay, of hugging your spouse. Okay, hearing your children's laughter in front of you, kissing them on the forehead. Those are things that cannot and will not be replaced by technology. So again, communication is not as straightforward as just talking face to face.
Yeah. I like what you're trying to say. It's very multi-dimensional when you are in person, and while it's digital, it's literally just two-dimensional. So I think just to add to that as well, I think the idea of human connection where touch is involved with your loved ones releases a lot of oxytocin, which is obviously super good for you when you have an adrenaline spike in your body, right? So super high level of stress when you touch somebody or you have physical touch kind of like helps dissipate a lot of the stress as well. So why are the healthcare professionals doing what they're doing? What helps them to? Okay, well, let's go back a little bit. So one part of it is the physical isolation. Are there any other common themes that are coming up with regards to the level of stress that they are facing?
If I could sum it up in one word, it would be fear. Okay, fear. Okay, we are facing something that is invisible.
Yeah.
Okay, we have patients who are asymptomatic. Okay, which means they have no symptoms. That means a person can come with a broken bone, no symptoms at all, and suddenly be positive for the virus. Okay, and we do not have a cure.
Yeah.
Okay, so that is the fear. I think that is a fear that not only the public have, but the frontliners are facing every day. Okay, now we have specific wards where we know that the patients are positive. Okay, so in these wards, it is rather well protected. They go in covered with their PPEs and so on. But we also have medical professionals in the districts of, let's say, Rompin, or I'm not going to name the districts, but let's say far away from the epicenters from the countries where they do not have these facilities. Okay, people are coming in and they have no protection at all.
Right.
Okay, these are the worst affected by fear and anxiety because they don't know. It might be this person or that person 3 weeks ago, which was totally
sure. Sure. So how would you label this fear? Is it the fear of unknown, the fear of personal death?
Fear of the unknown, probably fear of the unknown, because that's exactly what it is. We don't know much. We don't know much yet. Anyway.
Yeah, and I think in the mainstream level, although we are not put in high risk situations like coming face to face contact with patients who are tested positives, the rest of us in the masses, do you feel that it is the same experience as well? Maybe the intensity is different, but that experience of the fear of unknown is also present in the non-frontliners? Yeah, the public in general.
Yeah, exactly. Again, it depends on your level of awareness. Okay, but for those who are well read and know what's going on, the fear is real. Okay, we have reports of saying that the virus is airborne, and then the next day saying that no, it's not that airborne, and then we have reports saying that it might exist on certain surfaces for 2 weeks and so on. So all of these uncertainties are increasingly making us paranoid. Okay, and yeah, if you have a mental condition such as anxiety or depression or even
Yeah,
obsessive compulsive disorder,
yeah.
that's going to amplify all
Oh,
the
for
fears.
sure.
Okay.
Yeah,
So yes, I agree. Not only the frontliners, yeah, the public as well. These
yeah.
are uncertain times.
And regardless, every single day, each one of them shows up. Not each one of them, each one of you show up, and you continue to do the level best. And obviously, that is indicated by how well Malaysia is progressing with regards to our numbers in the curve. Why? What makes you risk it all to be doing this when you could obviously, come up with all kinds of excuses to not be there?
Yeah, we can definitely we can. Any slightest bit of sore throat or fever, and we're automatically exempt from duties for 2 weeks. Of course, we can, but I think I've spoken before previously about the concept of altruism. Okay, for the greater good. Okay, being a doctor, it is always about other. It is always about it is always about helping others. Okay, it is not a profession for selfish people. Okay, and that has been reflected. Not only doctors, sorry, I mean in the medical line, and that has been reflected really well in the level of service, in the level of care that we see in our country and every country in the world actually. Okay,
Yeah.
we medical professionals are basically laying their lives on the line to save others. Okay, and um, and there's nothing that can explain that than pure altruism.
Mm.
Okay,
Yeah.
the inner how do you say basically wanting to do good to others. Yeah,
Yeah.
that's all I can say.
Yeah, well, thank you so much to all of you for that. And thank you is really not enough. I think this is the greatest, most sacrificial act that a human could ever make. And I'm sure that this deed will be remembered once we see the rainbows in the sky all over again.
And so yeah.
Yeah. Would you be able to share maybe one or two stories that that you heard about without obviously breaching any form of confidentiality that really affected you or that really struck a chord uh, or even
Okay,
challenged you?
sure. I'm not going to talk about doctors today. Okay, I think we've heard a lot of stories about them. I'm going to talk about a lady whose job is to distribute food, okay, to the people who are to the wards in the hospital, okay, including the ones, including the positive, the COVID positive ward.
Mm-hmm.
Okay, so when I talk to her, okay, there is a sense of responsibility. Okay,
Mm-hmm.
she scored quite high in the depression and anxiety scale. Okay,
Mm-hmm.
so when I called her up and asked her how she was like, "Hey, I'm fine." I didn't
Sorry,
know I
what
scored.
did she do in the hospital again? Sorry, I missed that.
She works in the canteen,
Ah,
and her
okay.
job is to distribute food to the patients in the hospital.
Right.
Okay, so she scored
Who
quite
in the
high.
hospital?
Sorry.
Sorry, please go ahead.
Yeah. Okay. So, when I called her up saying that, hey, you did a survey recently, and your scores are rather high. Do you want to talk about it? And she was like, no, doctor, I'm fine. Okay. I'm doing this because it's my responsibility. It's always been my responsibility. I'm taking precautions. Okay, I'm serving the food. I'm making sure that everybody's getting enough, and so on. So what I want to highlight here is that the people battling this pandemic are of many levels. Okay, we have people like her who are probably never mentioned in our stories. Okay, we're talking about the cleaners, the people who throw away the PPEs, the people who clean up after the wards, the people who serve the food. These are also parts of the team that are heroes. Okay, so actually, I would just like to take an opportunity to highlight that to the public.
Yeah. And how do you feel that all of you are doing, such an incredible job risking your lives? And then how do you feel about human behavior with regards to COVID-19 when we're supposed to stay at home and we're supposed to look after ourselves so that we don't, we minimize as much of risk that we put on ourselves and others? How are you experiencing the public at large? Do you have any
Okay.
disappointments or?
Uh, I try as much to be to put myself in their shoes. Okay, it's extremely difficult to stay at home. Okay, when again we are social creatures, we need to move, we need to get out, and not everybody's home is where the heart is. That is something we need to understand. People who live in okay, but I think that everybody is doing their level best. That is the most important thing, actually. We do see some selfish people who are have no excuse actually going out. Okay, these people push them aside. Okay, we have the authorities to deal with that. Okay, what is important is that us people who understand the importance is for us to continue doing it.
Yeah,
Okay.
right.
I always talk about things that are under our control and things that are not under our control. Okay, so the things that are under our control is ourselves, our family, and our closest friends. So we're doing a good enough job if we can convince them to stay at home. For those
Yeah.
people who refuse, that's on them. Okay, there's nothing much we can do there.
Yeah. And I think what you said earlier struck a real chord in me with regards to the amount of compassion that you have, and that is not for it is not for everyone where the home is where the heart is.
Yeah, exactly. If you
Yeah.
if you live if you have 10 family members living in a 2-3 bedroom flat, okay, things are not going to be
Right. Yeah, it's not the best place to be living in. So
exactly.
with regards to the fear of unknown, as a psychiatrist, potentially without medication, what is the best and easiest way of being able to cope or conquer this fear of unknown?
Okay.
In maybe three
Um,
steps or so.
uh, if I could summarize, what I always say is always take a step back, zoom out, and take a deep breath. Okay, that's probably the most probably the first step, the most important step is to
Yeah.
zoom out. Okay, i.e. to look at the overall picture, okay, and see where you are. All right, concentrate on your breathing. Okay, empty your mind and refocus. Okay,
Yeah.
that's a very short sort of coping mechanism,
Right.
but I think the gist is that we need to take time, okay, and just
Yeah.
breathe.
Yeah, I think the concept of zooming out, as you said, and stepping back and taking a deep breath in is so underrated and so not scientifically explained enough for human being to understand the enormous amount of impact that it has. A single breath can take you from like your amygdala, which is all your drama and stress and fear, to the prefrontal cortex, where you have
Exactly, yeah. As doctors, we know all the theory. we have the theories of our deep breathing techniques, our mindfulness, our distraction therapy.
Yeah.
But when you're talking to the public, okay, the best advice you can give is exactly that. Stop, take a step back, and refocus. That's it.
Yeah.
Of course, that shall be the introduction. And you know, when you go into the detail, probably, you know, you can get more
Yeah.
detailed.
Right. And when you say refocus, how do you get them to refocus? What do you say to get people to refocus? What should they refocus on?
Okay, well, it really depends on what's causing the anxiety itself. Okay, so when I say refocus, again, I go back to the factors that we can control and what we cannot control. Okay,
Yeah.
so what you need to do is take control of what you can control and
Yeah.
forget about things that you cannot control. Okay,
Yeah.
if I'm being very, it is a very general piece of advice that it really
Yeah.
depends on the type of issues they're facing with. But generally, I think that's a fair summary of what I usually
Right.
do.
Right. And typically, do people do better, after phone calls with you, or what do they? Sorry, I'm sure they do better. What do they normally say after the end of a call with you? I'm assuming the calls would be like what, half an hour, 45 minutes, maybe a bit
Oh,
less.
definitely less than that. Less
Okay,
than
yeah, I
that.
know you've got so many people to get through.
It's not that. Usually the calls are more of a screening method. Okay,
Mhm.
and for those who do require more intervention, we usually schedule them for a different session where we
Okay,
focus on the problem.
a little bit
Okay,
more.
what we do is that we measure the response both subjectively and objectively. Okay,
Mm-mm.
so subjectively in the terms of a follow-up call to see how they're doing, a
Yeah,
simple mood indicator, if you rate your mood from 0 to 10, how are you feeling compared to the past few days, something like that. And
right.
objectively, we ask them to do the dust score again and compare the scores.
Okay. And typically, what do they say after a call with you? Like, what are the typical reactions that they would have when you call them or at the end of a call?
Okay. The first reaction will be surprise, saying that, wow, okay, this is not in our nature. We are typical Asians who do not talk about our feelings. Okay,
Mm,
so when we receive a call asking how do you feel, most of them are
mm,
rather surprised and taken
mm,
aback. But
mm,
a lot of them are positive. They give the positive feedback there and then. Thank you very much for
mm,
calling. I mean, it is good to know that we're being appreciated, we're being cared for. It's
mm.
good to know that if we do need help, we can call you back, etc., etc.
Yeah.
Yeah, the feedback has been good, and it's usually
So they're
instant.
super appreciative. Super
Yeah,
appreciative. Yeah, that
that,
you
that,
care, that
that's
somebody
generally that.
cares to pick up the
Yeah.
phone. And I think that's one thing that organizations need to do differently. I think we have gone so far into data analytics, putting out surveys that actually, in essence, if what we want at the end of the day is for proper employee experience, and nothing beats a phone call just to say, "Hey, how are you? I'm
Yeah.
genuinely concerned about you. What's going on?" And we kind of stopped doing that. We've gone so much into surveys and stuff, which is a great thing. Don't get me wrong, but nothing beats just picking up the phone. We've had a couple of our viewers coming in and saying, Dr. Hijaz, when we help people, we are also helping ourselves. And also one more person, Michelle, as always, Michelle's amazing, always here checking in with us. She says, I personally think that this is a time of testing and discovery of who we are, where we are, especially in our emotional state, especially when everything in life is almost put on pause. For example, I've heard some say that I'm a family man or woman and I'm a relationship person. But during this lockdown and work from home, I see the same people feeling miserable and restless. Even though they are homely people, they feel restless and miserable instead of seizing the opportunity to connect and engage with their loved ones. So, what is your take on this one?
Okay. Yeah. Uh,
Good question,
that's
Michelle. Thanks.
yeah, I understand the question. It is not a straightforward black and white answer. Family dynamics are very complicated issue.
Mhm.
Okay, so when we spend a lot of time with a person, okay, it, well, I read somewhere, well, I just quote, to really get to know a person, you have to do three things. Number one, travel with that
Yeah.
person. Number two, spend the night with that person. Okay.
Mhm.
Number three, do a business transaction with that person. Okay, those are the three
Sorry,
things. Okay.
what was the three again? Number one is to travel with the person.
Travel,
Number
two,
two,
spend the night. Number three is to get
second one is
involved,
spend the night.
spend the night with the person.
Okay.
Okay.
And third?
Number three is to do a business transaction with that person.
Ah,
Okay,
okay.
really get to know that person. Okay,
Right.
so when during this lockdown, okay, everybody is forced to spend a lot of time with their family members. Okay, that can be positive. Okay, but
Mhm.
again, um, as
Yeah.
Michael said, instead of seizing the opportunity, it can actually be cause for conflicts. Okay, because
Yeah.
maybe previously we have our, if I may use the word, me time from 8 to 5, and then we come back and spend the night. Okay, so it's a rather limited time. Now we are spending the whole day for the past 20 days, and we tend to
Yeah.
get annoyed.
Yeah.
Okay,
Yeah.
my advice is that that's actually normal. That's
Mm.
normal.
Mm.
Okay, write it out, put a positive spin on it, find ways to reignite your relationship with your family members, do
Mm.
something different, play some games. It's easier said than done. But and of course 20, 30 days is not a short time, but
Yes.
that's the reality of the situation we're in.
Yeah.
Okay, probably find some time to discuss the negative traits and see whether you can find a solution to it. It is, again, it is not, it's easier said than done.
Yeah.
But yeah, that's
Yeah, probably after MCO, you might want to discuss it. Right now, it feels like you're climbing a mountain and you just need to take
yeah.
one day, one step at a time, and be there with each other rather than, be the strength that pulls each other up rather than exposing the weaknesses that are going on as well. So,
one thing
you
one thing
call, yeah,
from one thing we can take out from this is that human beings are very resilient creatures. Okay,
mm,
we can put whatever difficulties in front of them, but have faith, and they will find a way out
that's
somehow
true.
or another.
That's true.
So you
That's
always have
true.
faith.
That's true.
Basically, faith in humanity. Yeah.
Mm. Yeah, and Dr. Hijas, you've called a lot of people to ask them how they are. Has anybody called you to ask you how you are?
Okay. Well, I mean, that's probably the straightforward answer will be no. But we have a good team. Okay, we're
Mm.
supporting each other at work. I have good family support at home. So that's no issue for me. We're doing fine.
Yeah,
Thank you for asking.
but that sounds a little unfair. I think there should be somebody calling you, and hopefully there is somebody listening in from your hospital and tuning in to say
Yeah,
that you need
definitely. Yeah,
to.
I'm sure. I'm sure.
Everybody, no man or woman should be left unengaged at this period of time. And we're at 6:32, but I'm really curious to know. You've been through a really massive episode with your health. You've had a heart attack. You're really young, I'm imagining, and now you've moved from one life crisis into another potential life and professional crisis. How do you make sense of life?
Um, So yes, for the viewers who are just listening in, about a month ago, despite my denial, I suffered a heart attack and was admitted to the hospital, and yeah, I got out of it. Okay, the circumstances probably a mixture of some genetic factors and probably lifestyle as well. Okay, I shall not go into that. But yeah, so currently I'm doing well physically. No issues with that. as you said, I'm young. I'm fit. Hopefully. I will have to admit, giving advice to people on how to deal with crisis compared to when you face one yourself, are very different things.
Different.
All that advice goes out of the window. Okay,
Mm.
I'm in my 30s and I've had a heart attack. That was not an easy pill to swallow at
Mm.
first. Okay, but again, that the resilience is something that you build up over the years.
Yeah.
You
How,
got to
how are
get
you
better.
making sense of life? You've been two crises in very short period of time. What does life mean to you in a unique way now than how you viewed life before? How are you making sense of life?
Oh, okay. Never really thought about it that deeply, but from the top of my head, um, it is very important to cherish what you have, uh, and appreciate those around you. Okay, that's probably the important thing I got out. How I view life is that I'm sorry to say this, but life goes on. Okay, I mean, I just see it as okay. I had a heart attack. I've got to get better. I have a family. I have patience, and yeah, that's it. It's a simple, a rather black and white view of things. Uh, well, that is my method of coping, actually.
Yeah.
Okay. Functioning
Yeah.
and going back exactly to your functioning self. That's probably the most important thing. And thankfully, I have. There's nothing really. There's been no residual issues from that
Right.
health stuff, thankfully.
Yeah. And when you think about the past few months, obviously very intense, what still brings a tear to your eye or really touches your heart in the past few months that you've gone through personal, professional crisis?
Probably. Okay, that's a difficult question. Well, wait, I guess when in times of distress, times of crisis, the most important people in your life will be your family. Okay, and well, during that difficult period, they came together. My wife was looked after. My wife managed to settle the family. It was good. It was good. I felt that I was in good hands. I felt that I could concentrate on my own recovery because of them. So yeah,
Correct.
family is probably the most important coping mechanism I have right now. Yeah,
Better than any doctor.
yeah, definitely.
Well, it's been a real pleasure speaking with you, Dr. Hijaz. I've met many psychologists, few psychiatrists, many counselors in the past. You're very impressive, and I cannot wait to see who you become in the next 5 to 10 years. I'm sure Malaysia is going to really benefit from not just what you know, but who you are and how you come across as well. So thank you for making this so meaningful. And I really hope that you get a call from somebody soon to ask how you are and to make sure that somebody's looking after you wholeheartedly as well while you look after everybody else.
That's great. Thank you very much.
Thank you. Well, yeah,
Uh,
God bless. So let me just share with you some feedback from our friends, okay? So Michelle saying, recap to get to know a person, travel with the person, spend a night with the person. And I really like the last one. Try and do a business transaction with the person. I have learned a lot with regards to how people look at money. And yeah, it's very revealing. Michelle also says, awesome feedback and advice. Thank you so much, Dr. Hijaz. And it's so encouraging for Michelle to also hear that human beings are very resilient and to have faith in ourselves. So obviously, you've made a huge impact on at least a couple of people over here, and I'm sure more going forward as we share the video around as well. So thank you so much for being with us.
yeah.
Once again, I'm Hetal, and this is Dr. Hijaz, a trainee psychiatrist. together with us, speaking about his insights, having dealt with and worked with healthcare professionals during COVID-19. Okay, see you. Take care.
Thank you.
Bye. Bye.
Bye.